Let's talk coronavirus.
We have breaking news at 5. There are now 10 confirmed coronavirus cases in Pennsylvania. The schools that are closed are a high school, 2 middle schools, and 2 elementary schools.
Right now, the Dow is settling down somewhere in the down 2,300 range, ending a grim day on Wall Street today.
The CDC tonight says Europe is the new epicenter of the epidemic, with 70% of new cases originating here.
Coronavirus 2019, or COVID-19, is probably the biggest thing that news outlets are covering at the time this video posts. I'll be covering how the virus is spread, what viruses do once they infect you, and what it could mean for you, the viewer. Now, before I begin, a quick disclaimer. I am nowhere remotely close to an expert in virology or a medical professional. However, I am scientifically literate. I will be getting my information from primary sources, the CDC, doctors, and scientific journals. Coronaviruses get their name because of the crown-like spikes on their surface. Webster defines the coronavirus as a family of single-stranded RNA viruses with club-like projections stemming from the lipid envelope. The CDC states that there are 7 known coronaviruses that affect humans. 229E and NL63 are alpha coronaviruses, while OC43 and HKU1 are beta coronaviruses. These strains are the 4 that commonly affect human beings. According to V. Corman et al., these 4 strains are responsible for 30% of the common cold in humans. The other 3 strains of coronaviruses are the more serious ones: MERS-CoV, SARS-CoV, and SARS-CoV-2. MERS is a beta coronavirus associated with Middle East respiratory syndrome. SARS is a beta coronavirus that is associated with severe acute respiratory syndrome, and SARS-CoV-2 is the coronavirus that is associated with the current coronavirus outbreak. These are 3 novel coronaviruses. They affect animals and evolve into new human coronaviruses. When a virus enters an organism, it needs to find a host cell to replicate. Once a virus attaches to a host cell, the cell will engulf the virus through endocytosis, which is when a cell takes in a foreign object by forming a pouch with its membrane to form a vacuole. The virus expels its RNA and directs the host cell to synthesize viral enzymes and proteins to form new virions. Eventually, once the cell is filled with virions, the viruses will burst out of the cell membrane, oftentimes destroying the cell with it. As long as the immune system is functioning correctly, it will begin to fight back against the infection. Along with this, the body temperature will rise and produce more phlegm and mucus to aid in the destruction of the virus. The reason people's bones ache when these actions are occurring is because the bones are ramping up the production of white blood cells to join in the fight. At this point, your body uses DNA to produce antibodies, which are blood proteins that combine with different substances and are used by your body to identify and defend against intruders in your body. Before I dive into COVID-19 directly, I do want to note that there are organizations around the world that are working on a direct treatment. However, there is no current vaccine and it could take years to find one. The best thing that can be done for COVID-19 are treatments that help with other coronaviruses like SARS and MERS. These include antiviral medications, mechanical ventilation if the individual is unable to breathe by themselves, steroids to reduce swelling, and blood plasma transfusions for critical cases. Ryuji and Liu et al. Proposed that this specific strain of coronavirus originates from bats. However, researchers at South China University stated that humans were most likely infected through an intermediary animal. In this case, the university has found that the coronavirus and pangolins, which is a type of anteater, match 99% of the RNA in the human strain. Bats hibernate in the winter, so this intermediary animal is crucial for the virus to spread to humans. Thoughts now are that the animal that has infected humans was sold at a fish market in Wuhan, China. We all know this virus originated in China, but I cannot stress how important it is we do not discriminate or spew negative stigmas against people who come from this part of the country. This negative stigma towards an identifiable group is oftentimes associated with lack of knowledge about how the virus is actually spread. You can see this stigma in the U.S. when you look at Philadelphia's Chinatown.
Here at home, there are rising concerns about the Wuhan coronavirus. Philadelphia officials are hoping to give residents as well as restaurants and businesses a boost of confidence and support. Natasha Brown takes us to Chinatown, where the mayor visited today.
We have confidence that everybody's safe coming to Chinatown.
As a major show of support for residents and businesses in Chinatown, Mayor Jim Kenney and other city officials had lunch at the Ocean Harbor restaurant Thursday afternoon. They're hoping to quell rising fears about the coronavirus outbreak.
We don't want people overreacting to this international situation. We're under control here in Philadelphia and around the country, and we don't want people to stop coming to Chinatown and patronizing these businesses.
Although there have been no confirmed cases of the virus in Philadelphia to date, restaurant and business owners in Chinatown say they're feeling the brunt of the concern surrounding the international health issue with its epicenter in Wuhan, China. Many say they're losing business amid its global spread.
Now, how can you tell if someone has COVID-19? The most notable symptoms are fever, cough, and shortness of breath. Other symptoms include fatigue, runny nose, sore throat, headache and body aches, and diarrhea. There are similarities to the common cold and the flu in COVID-19 symptoms. Compared to the common cold, COVID-19 is not preceded by a runny nose, and fevers aren't symptoms of the common cold. Compared to the flu, however, COVID-19 symptoms occur more gradual than the flu. They occur 2 to 14 days after exposure. The flu symptoms all come very suddenly. COVID-19 has also affected less children than the flu does. Transitioning to who are more susceptible to 2019's coronavirus, information from China has shown that older adults, 60 and up, and people with chronic medical conditions like heart and lung diseases, as well as diabetes, and those with compromised immune systems are most affected. The CDC recommends that individuals that are susceptible to contracting this virus take certain precautions to avoid contracting COVID-19. Individuals that rely on different medications or other medical supplies should talk to their medical provider about obtaining extra supplies so you can have them on hand in case of an outbreak in your community. If you cannot obtain extra medications or medical supplies, try mail order. Experts say that the coronavirus cannot survive on paper for prolonged periods of time, but can live on hard substances for a few hours. Having different supplies to treat fever and other symptoms are important because most can recover at home. And the last thing for people who are more susceptible to contract the virus is to talk to your healthcare provider for more information about how COVID-19 could affect you. How can you help in your prevention of the coronavirus? Before that, I want to dive into the statistics about this virus. Worldwide, there have been 126,004 cases, 6,000 of which were severe. There have been a total of 4,614 deaths from the virus, and over 67,000 people have recovered. There are currently 55,000 current cases of infected patients, and out of the 72,000 closed cases, around 94% have recovered. As for countries involved, China has more cases than about all other countries combined. The USA falls 9th on the list with 1,276 total cases. Out of these, there have been 37 deaths with 1,224 active cases. There are 15 who have recovered and 10 who are still in critical condition. The coronavirus has a worldwide fatality rate of 3.4% with a transmission rate of 3, meaning for every 1 case, there are 3 new cases. By comparison of infected individuals, the flu kills less than 1%, SARS killed 12%, MERS killed 42%, and Ebola killed between 50 and 90%. To help protect yourself against the coronavirus, some measures you can take are washing your hands as often as possible for at least 20 seconds or using hand sanitizer that is at least 60% alcohol, and you can avoid touching your eyes, nose, or mouth. Please avoid contact to people who are sick to avoid contracting the disease. Cover your coughs and your sneezes, as this is how COVID-19 is transmitted. It is contracted through the air, normally of a radius of around 3 to 6 feet from somebody who is coughing or sneezing. If you do contract this illness, if you're around other people, wear a face mask to avoid transmitting the virus, and if a face mask is unavailable, cover all coughs and sneezes. As a preventative measure, experts are saying that face masks are not an effective way of protecting yourself. If you are not infected or not caring for somebody who is infected, you should not be wearing face masks. It creates an equipment shortage where medical professionals are unable to procure masks. Without the masks, these medical professionals are unable to safely care for people infected with the coronavirus and thus puts them and even more people in the community at risk. Another thing you can do is if you're sick, just stay home. Don't leave your house because it's not worth infecting more people. Please remember that this video is accurate to the date at posting. In a couple months, the statistics and different properties of this video could change dramatically with new scientific discoveries. Please stay healthy and stay safe. Don't forget to like and subscribe, and I'll catch you guys next time.
Everybody on the top got the same sound. Everything I'm about to drop, make a name now. Yeah, y'all don't really know, y'all don't really know. Y'all don't really know, y'all don't really know. Yeah, I ain't never gonna be the same now. I'ma tear up this whole fucking game now. Yeah, y'all don't really know, y'all don't really know. Y'all don't really know, y'all don't really know.